I'm Pam McDonald. I'm here to share my story about being diagnosed with cervical cancer and going through fertility treatment. It was 5 months after my husband and I were married, and I had been experiencing a lot of bleeding symptoms and went in to see the gynecologist, and she did an exam and stopped the exam midway through. I started heavily bleeding, and so she told me I could sit up, and so I did. And I was expecting her to tell me that I had some sort of hormonal problem, and she shared with me that without a doubt she knew that I had cervical cancer and that I would need to go through treatment quickly, very quickly. I was diagnosed with stage 2B, which means that it had advanced to my lymphatic system. My tumor was about the size of a large lime, so it was quite big. So once I received my diagnosis, my husband and I talked about receiving fertility treatments. And once we talked about fertility, we had a very short window of time where we could get in to see somebody. I think I had about a 2-week window where the fertility clinic was able to do an ovarian stimulation and retrieve eggs, which they turned into embryos with my husband's sperm. Once I stopped that, or once that was completed, we managed to get embryos and froze those. So going through cancer treatment, I knew that I was going to be able to have a chance at having a baby.
My name is Lorrie-Anne Morley-Kapeluck, and I'm 55. And the reason I'm here today, I guess, is to sort of share what's happened to me during menopause, which has been kind of a scary, interesting journey, to say the least. Menopause was kind of coming on, and I could tell just my periods were erratic and things were changing. But all of a sudden, I just was not able to sleep at night. I was having terrible night sweats. And at one point, my husband was wondering if he needed to take me into emergency because I was just soaking wet, and he thought I had a fever. So when you just are not comfortable going out to some degree because you don't know when you're going to have a sweat and when you're going to be completely wet, it's quite embarrassing. Like, I think at night too, like just not getting the sleep. And with my husband, you know, I felt bad for him too, because he was worried about me because he knew I wasn't myself. And sometimes I'd be a little shorter than I probably would normally be with him, just because I was just like uncomfortable. But when you're so uncomfortable and that heat comes from inside your body and you can't, you know, you're willing to try just about anything.
My name is Dr. Angela Baerwald. I'm a family physician and assistant professor with a subspecialty focus in women's health at the University of Saskatchewan. The stories from patients that you have just heard are all too common. From a fertility perspective, we know that 16% of the Canadian population experiences infertility. However, the chances of getting pregnant with current treatment are only 30 to 40%. Another growing population of women requiring fertility therapy are those diagnosed with cancer. Thankfully, with advancements in cancer therapy, more and more women are living longer after treatment. However, chemotherapy is toxic to the eggs within the ovaries. Providing timely fertility therapy and egg freezing prior to chemo provides women with options for having a child down the road without delaying their cancer treatment. Fertility therapy is often very expensive and time-consuming, and as a result, women can bear significant financial and emotional burdens for their dreams to build a family with limited chances of becoming pregnant. On the other end of the reproductive spectrum, we know that more than 50% of women experience unwanted symptoms of menopause. The goal of our study is to characterize how hormones regulate follicle waves during the menstrual cycle in women. Our textbook understanding of the menstrual cycle that has persisted for more than 60 years has shown that follicles, the fluid-filled sacs in the ovaries that contain the eggs, grow only during the first 2 weeks of a woman's cycle, leading to ovulation. Contrary to these long-held notions, we have shown in our lab that follicles grow more than once in multiple waves throughout the entire menstrual cycle. Our findings have provided a new model for the menstrual cycle and have led to the development of new ovarian stimulation treatments across the globe for women with infertility or cancer. 50 women aged 18 to 40 will be recruited from Saskatchewan. Ultrasound exams and blood work will be conducted within our lab in the Department of Family Medicine. Ultrasound will be used to characterize how follicles grow and ovulate over the menstrual cycle. Blood samples will be analyzed locally and also shipped to Australia for evaluation. How the follicles grow and how hormones regulate their growth throughout the cycle will be determined by our team.
I'm Dr. Shu Foong. I'm the Medical Director of the Regional Fertility Program in Calgary, Alberta. The work that Dr. Baerwald has conducted in the past, showing the presence of multiple follicle waves that crop up during a patient's menstrual cycle is especially important to look at how this has actually changed our clinical practice today. In the world of oncofertility specifically, we've been able to use this knowledge to be able to provide very, very important fertility preservation treatments to these patients who are facing chemotherapy and radiation that may destroy their ability to have a family in the future. Future understanding of these waves of follicular development is very important. One such importance is to be able to understand any other factors that can influence these follicle waves. Are there any factors that can improve the ability to recruit more follicles? Are there better timing in a cycle based on other hormones that are in combination that occur during a patient's menstrual cycle?
One of the biggest impacts that our research can have is that we can take the research we've already conducted to date, which has developed a new model for the menstrual cycle, and then develop new therapies for women that are needing assistance with managing unwanted symptoms of menopause, those requiring different types of hormonal contraceptives, and those requiring fertility therapy. So we don't understand what causes hot flashes and other unwanted symptoms of menopause. So understanding where hormonal changes occur as women age will help us to understand what's causing those symptoms and then allow us to provide better treatments for them. And from a fertility point of view, we know that conventional fertility therapy is started at the very beginning of a woman's menstrual cycle and only at the beginning of a woman's menstrual cycle. And so with the research that we've already conducted, we've been able to develop new fertility therapies that have been implemented all over the globe, whereby fertility therapy can now be initiated at any stage of a woman's cycle without having to wait until she starts her cycle. And that's really important for patients that are needing emergent fertility therapy for cancer treatment before they undergo chemotherapy, for any woman that really needs to undergo treatment emergently.
Being able to start my fertility treatments immediately as soon as they needed to be started without worrying about where I was in my cycle or what was happening within my body was what enabled me to be able to have that hope of having a baby through my cancer treatment.
I think that if the research can find out more about the hormones and how to regulate them and how to do it in a natural process, I think it would be beneficial, for so many women.
And we ended up having a baby this May. So this is our little guy that we had. I don't know if you can see that, but he's our pride and joy. And I am so grateful for the research that's been done so far, enabling me to start that journey, whether it ended up the same way or not. That research is what started me on this journey to have my baby. And we're just extremely grateful that it's been done and that we've got our little guy.